Let's take a look at the brainstem, which includes the diencephalon, which we see in green, the midbrain, which we see in pink, the pons in purple, and the medulla oblongata in orange, bound inferiorly by the spinal cord and superiorly by the lateral ventricle. Let's take a look at this in some other images. A couple things I want to point out are these two bumps on the posterior aspect of the midbrain, which are the superior and inferior colliculi. If we look at this image right here, we can see the medulla oblongata here, the pons, the midbrain, and the diencephalon in this space right here. This represents the pituitary gland, which we see in this image. Here's the pituitary gland. Keep in mind this image is showing the right cerebral hemispheres and right brainstem, whereas this is showing the left cerebral hemisphere and the left sagittal section of the brainstem. And this is also a left cerebral hemisphere, medulla oblongata right here, pons, midbrain. We see these two bumps, superior colliculus here, inferior colliculus right here, and this is the diencephalon. So let's get into the more detail of the brainstem. The diencephalon is composed of the thalamus, the epithalamus, and the hypothalamus. The great majority of the diencephalon is occupied by the thalamus, which is described as being the gateway to the cerebral cortex, because so many tracts and fibers pass directly through the thalamus. The hypothalamus right here is involved in thermoregulation, appetite, integrating center of the ANS, memory, emotions, and it releases a number of neurohormones. Coming off of the hypothalamus is the pituitary gland, which I have drawn in two different colors because the posterior pituitary, which we see in green, is nervous tissue like the hypothalamus and the entire diencephalon, whereas the anterior pituitary is a different color because it is not composed of nervous tissue. It is composed of glandular epithelial tissue. So we have the hypothalamus, the thalamus, and the epithalamus is mainly the pineal gland, which we see right here, which releases melatonin and is involved in circadian rhythms. The midbrain in pink right here contains the substantia nigra, which releases dopamine and is involved in inhibiting motor signals and unwanted muscle contractions. Once again, on the posterior aspect, we have the superior and inferior colliculi, which are involved in vision and hearing, respectively. The superior colliculi regulates blinking, focusing, pupillary constriction and dilation, and tracking objects, whereas the inferior colliculus is involved with processing auditory information and locating sound in space. Moving on to the pons, it has a number of cranial nerves, specifically cranial nerve number 5, the trigeminal nerve, which innervates the head and face, cranial nerve number 6, the abducens, which regulates lateral eye movement. Cranial nerve number 7 is the facial nerve involved in facial expressions, and also cranial nerve number 8, the vestibular cochlear nerve, which is involved in hearing. The most inferior aspect of the brainstem is the medulla oblongata that has a cluster of a number of nuclei or cell bodies. One is the cardiac center, which regulates the rate and force of ventricular contraction of the heart. The vasomotor center, which vasodilates or vasoconstricts blood vessels to regulate blood pressure. There are a couple respiratory centers that regulate the rate and depth of respirations. And there are other nuclei involved with things such as vomiting, sneezing, and speech. That is the brainstem.